Hi, I am Dr. Ayyappan V Nair. I am a shoulder and a sports injury specialist at Manipal Hospital, Whitefield. Frozen shoulder is an entity or is a disease condition of the shoulder where it is characterized by a lot of stiffness in the shoulder. The shoulder becomes extremely stiff. In technical terms, surgeons call it as adhesive capsulitis. Adhesive as in adhesion or sticking, and capsulitis, capsular inflammation. So I was trying to describe that how the shoulder is basically a ball socket joint. We have the ball in this position and we have the socket. So this ball socket joint is completely covered. The innermost covering of the ball socket joint is by a structure called as a capsule. So capsule is like a thick membrane which covers, or is like a balloon kind of thing which covers the shoulder in total. So this capsule can get inflamed, and once it gets inflamed, it becomes very sticky to the bone. It becomes very adherent to the bone, and this is called as adhesive capsulitis or frozen shoulder. So this adhesive capsulitis, it is basically, if you look at what kind of people usually have it, one would be, and it is found more in diabetic patients. Like in 50% of the patients of adhesive capsulitis, people should come to the shoulder clinic with a frozen shoulder or stiffness of the shoulder or adhesive capsulitis are diabetic patients. The remaining are non-diabetic, but there could be a reason that there couldn't be a reason why these people have it. Looking at the reasons, so one is called as primary adhesive capsulitis, where there's no particular reason. It could be diabetes, it is found in diabetic patients, or some other group of patients who don't have any particular reason. It can just come just like that, adhesive capsulitis. The other is called secondary adhesive capsulitis. Secondary is because if you have a trauma, if you have fallen on the shoulder, if you have twisted your shoulder, if you have injured it in some way. So what happens is, if I have a pain in my shoulder, then I don't try to move my shoulder at all. I try to subconsciously restrict the movements. And if the shoulder is a shoulder, or a matter of fact, any other joint is not moved, then the shoulder or the joint becomes stiff. This stiffness is because the capsule has become adherent, it becomes sticky to the surface, and there is no movement in the capsule, and the capsule restricts all movements, and this is technically our adhesive capsulitis. So again, coming to sum up the reasons, it could be in diabetic patients, it could be primary, or it could be secondary. Primary is there's no reason, and secondary is where there is some trauma to the shoulder. Frozen shoulder is basically characterized by pain and stiffness of the shoulder. The patients come to us with pain. There will be pain in the shoulder associated with tightness or stiffness in the shoulder with difficult movements. So that is the most common complaint. Frozen shoulder is a self-limiting condition, or it is a self-correcting condition. That means over a period of 1 to 2 years, the patient will be almost absolutely normal, even if you don't take any kind of treatment. During the initial period of 1 to 3 months, the patients have a lot of pain and stiffness. And after that, for the next 6 months to 1 year, the pain comes down, but the stiffness persists. And during the last phase, that's the recovery phase, the pain as well as stiffness completely comes down, and the patient regain almost 80 to 90% of their movements, even without any kind of treatment. So now the treatment is required only if the pain is more, or if the stiffness is more, or if the patient can't wait for this 2-year time period for it to completely recover. Diagnosis of frozen shoulder is made by clinical examination. That is, hearing the patient out, finding out if he is diabetic or not, is there a primary cause or not, and then moving the shoulder. That is, physical examination of the shoulder is the most important sign. So a shoulder surgeon will be able to make out if the patient is called adhesive capsulitis or frozen shoulder just by physically examining. And confirmatory diagnosis would be, we can do an ultrasound scan. The scan will tell us if any other problem is there. That means, okay, we are eliminating all the problem with an ultrasound scan, but the primary diagnosis is made by just a physical examination. It is a self-limiting condition. It is a self-recovering condition. You get 80 to 90% of your movements back. Do we actually have to treat it? So during the initial phase, that is the acute phase, where the pain and the swelling is there, the patient has a lot of pain and the stiffness is also quite significant. In that condition, we can do certain things to reduce the pain and inflammation. That is, number one would be giving an intra-articular, that is inside the joint, inside the tight capsule, we could give an intra-articular injection of steroid. That a steroid injection can be given. This will definitely reduce the inflammation significantly. It works like magic and the patient are very, very comfortable after a steroid shot inside the joint. This is followed by physiotherapy. So injection, a few days of rest, 1 or 2 days of rest, then physiotherapy. Now once the pain and inflammation subsides, the physiotherapist can actually work on the shoulder, start moving the shoulder, stretching out the capsule so that the movements come back fast. So this treatment, where injection followed by physiotherapy, would take around 2 to 3 months in the hand of a very good physiotherapist. You'll have excellent results. So the next treatment option would be a surgery. For example, if a patient is given intra-articular steroid, not responding, we have tried physiotherapy, not responding, those kind of patients can be treated with something called as an arthroscopic procedure, arthroscopic capsular release. So what we do here is, again, put a camera inside the shoulder, find out the tight capsule, release it. It's just a 10-minute procedure. Release it means we completely remove the adherence, and just on the operation theatre, operation table itself, we get our full movements back. This is called as arthroscopic capsular release. Wonderful results, and the patient, once the physiotherapy is initiated, they go back to their normal life in 2 to 3 weeks. That's an excellent procedure we have. In olden times, we used to do something called as manipulation under anesthesia, where the surgeon used to manipulate the shoulder, twist the shoulder, stretch out the capsule under anesthesia. We don't do that anymore. Now the latest technique is arthroscopic capsular release.